Here is exactly how the Certified EKG Technician exam works and how to pass it. 120 questions, 2 hours, and a blueprint that surprises almost everyone. Reading rhythms is the smallest part of the test. The CET is awarded by the National Association, NHA. It is an accredited certification, which matters because employers and state programs check for that accreditation rather than for a brand name. The certificate is valid for 2 years, and you renew it with 10 continuing education credits. The exam is multiple choice, taken under proctored conditions on a computer, either at an authorized test site or through a remote proctor. Bring a current government-issued photo ID with your signature on it. If the address on that ID does not match what you registered with, bring proof of address too, because that mismatch turns people away at the door. 120 questions in 2 hours, but only 100 of them count. 20 are pretest questions NHA is trialing for a future exam, and they do not affect your score. You are not told which 20, so treat every question as live. The passing score is not a percentage. NHA uses scaled scoring because there are multiple versions of the exam and the versions are not identically hard. Your raw score is converted onto a scale, and the passing scaled score is 390, which stays the same no matter which form you sat. So the number of questions you need shifts a little from form to form. Eligibility has 2 halves. First, a high school diploma or equivalent, or you are on track to finish one within 12 months. Second, one of 2 routes. Either you completed an EKG technician training program within the last 5 years, or you have supervised work experience in the field, 1 year of it within the last 3 years, or 2 years within the last 5. And on top of whichever route you take, you must show evidence that you have performed at least 10 EKGs on living people, not mannequins, not simulations, 10 real patients. If you do not pass, you wait 30 days before trying again, and you pay the full price each time. But there is a limit people miss. You get 3 attempts, each 30 days apart, and after a third failure, you must wait a full year before the next one. That makes the first attempt worth preparing for properly. Now the blueprint, and this is the part worth studying. The 100 scored questions split into 3 domains. Safety, compliance, and coordinated patient care is 32 questions. EKG acquisition is 44. EKG analysis and interpretation is 24. Read those numbers again, because they are the opposite of what most candidates expect. Acquisition, meaning actually getting a clean, correctly placed tracing off a real patient, is the single largest domain, and it is nearly half the exam. Analysis and interpretation, the rhythm reading everyone studies flashcards for, is the smallest. Add safety and patient care to acquisition, and more than 3/4 of your score comes from things that happen before anyone interprets anything. If you are drilling rhythm strips and nothing else, you are studying the smallest quarter of the test. 3 real questions from the free bank. First, acquisition. You are placing the precordial electrodes for a resting 12 lead. You have found the sternal angle and counted down to the 4th intercostal space. Where does V1 go? The 4th intercostal space at the right sternal border. V1 goes right, V2 goes left, in that same interspace, so the pair straddles the sternum and faces the septum. Swap those 2, and you have corrupted the tracing while everything still looks plausible. Second artifact. A tracing shows a very fine, rapid oscillation of identical height and perfectly even spacing, thickening the baseline into a fuzzy band, and it is in every lead. What is it? Alternating current interference. The tell is uniformity. The waves are identical and evenly spaced because they come from a steady powerline field, not from the patient. Compare that with muscle tremor, which is jagged and irregular in both height and timing. Even and identical means electrical. Ragged and random means the patient. Third, rate. A 6-second strip at the standard 25 mm per second contains 11 QRS complexes, and the R to R interval keeps changing. What is the rate? 110 beats per minute. Because the rhythm is irregular, the 6-second method is the only valid one. Count the complexes in 6 seconds and multiply by 10. The 1500 method assumes a constant R to R interval, so on an irregular strip, it gives you a number that is precisely wrong. So, 4 ways to prepare. 1. Weight your study time the way the blueprint is weighted. Lead placement, skin prep, and artifact deserve more of your hours than rhythm flashcards do. 2. Learn the landmarks as a procedure, not as a picture. V1 and V2 straddle the sternum at the 4th intercostal space, V4 sits at the 5th space on the line, and V3 is simply the midpoint between V2 and V4, so it cannot be placed until V4 is. 3. Practice telling artifacts apart by their signature rather than by how they feel. Even and identical, ragged and random, or a slow, drifting baseline each points somewhere different. 4. Know which rate method a strip allows before you calculate, because choosing the wrong one is the most common way to lose a question you actually understood. To recap, 120 questions, 100 scored, 2 hours. A scaled score with 390 to pass and no percentage. 10 real EKGs before you are even eligible. 3 attempts 30 days apart, then a year. And acquisition, not interpretation, is where the exam actually lives. Practice all 5 areas free at .com/en/EKG-technician. Heart anatomy and conduction, 12 lead placement, rhythm identification, artifact and troubleshooting, and patient safety, in English, Chinese, or Spanish, with a full explanation on every answer.